Many people I come across wonder what happens in a pain clinic. I think almost everyone would know somebody who has persistent pain, but it would be a minority that knows somebody who's been to a pain clinic and actually had a conversation around that. So for many people, it's a mystery. And for some patients, their lack of knowledge about what goes on actually makes them reticent to attend, and they stay at home having continuing pain rather than having assessment of that pain. They may be concerned, in fact, that they're going to go to a pain clinic to be told there's nothing that can be done, you simply need to accept your pain. And that's sort of almost like a sentence for them to hear. And so they think, well, that's the last place I want to go, is to be told something terrible like that. So they don't attend. Now that's kind of the opposite of what actually goes on in a pain clinic. And I think because it's a very small branch of medicine, it's probably got one of the least numbers in terms of pain physicians that are present in any particular country. And it's a relatively new specialty. So pain clinics didn't sort of formally exist until after World War II. They came into existence from generally anaesthetists who were running field hospitals in World War II, dealing with soldiers who had lots of shrapnel injuries, and they had a particular type of nerve pain that we call neuropathic pain. And then the skills they learnt in managing these conditions, they took back to civilian life, and they realised that there were actually patients in civilian life in the United States and in Europe and here in Australia, for example, who also had the same type of nerve pain or neuropathic pain. And they started to realise they needed to use the same skills that they had in the field hospital in World War II, and so they set up what are termed multidisciplinary pain clinics. Now this funny word, multidisciplinary, means that you don't just go see one person who does anything and everything for you in the clinic. Multidisciplinary means there are different disciplines of health care represented who are available to help you in the pain clinic. So in a pain clinic, for example, there will typically be a pain physician. There will be specialist pain nurses. There will be physiotherapists and exercise physiologists, who are a branch of physiotherapy, particularly focused around exercise programs. There will be psychologists. There may well be a psychiatrist. There may well be occupational therapists. So we have a range of people involved, because each one of these people brings a unique skill set, and we need a range of skill sets in order to optimally treat somebody who has persistent pain. So what happens if you get a referral to a pain clinic? What happens if you come along? Typically what's going to happen is there's going to be an assessment process. Now that assessment process will actually often start with you receiving information via email or in the mail asking you to fill out a series of questionnaires. Now these questionnaires are some obvious ones like tell us about your pain, or what medications are you on, or what treatments have you had in the past, for example, what surgeries have you had. So that's a sort of basic intake of information. But in addition to that will be a series of questionnaires really wanting to explore your feelings about the pain, your concerns about the pain, what you think might happen in the future with your pain, what do you think you can do and what do you think you can't do with your pain. So we're looking at what we call cognitions, thinking processes about reacting to the environment with your pain, and we're also looking at assessing behaviours, what behaviours are expressed, what behaviours are not expressed as a result of having persistent pain. So we're no longer really looking at the body part by itself, and we ignore the rest of the person attached to this body part. That's the opposite, really, of what a pain clinic does. A pain clinic will be focusing, of course, on the body part, but they'll be focusing on the whole effect of this pain on the person, and who is this person, and what skills do they have to manage their pain, and how can they be helped to manage their pain. So the assessment process will then occur that typically you return these forms, you'll get an appointment, and you'll come to see either the pain physician by themselves, or you'll see a group of people on your first day, on the intake day of the assessment, where you may see a pain specialist, you might also see a pain psychologist and a pain physiotherapist. And from that process, that team will decide, okay, we think that there are a bunch of things going on here that we can improve. There are things that we would like to bring to the table that haven't been brought so far. And that may involve the four main treatments that are available in a pain clinic. And that is using medications, so we call that pharmacotherapy. And there are different types of medications involved. They're not simply talking about opioids or painkillers. In fact, opioids are not dramatically used anymore in pain clinics. And indeed, in the original pain clinics of the 1950s and 60s, they were not dramatically used. But a whole range of different medications that may be appropriate for certain individuals. And again, it will depend on the very specifics of your pain, what's causing it, and the holistic assessment of you as a person. So besides the pharmacotherapies, we also look at psychological therapies. So we say, can we assist this person to reduce their distress? Can we assist this person to improve their sleep? Can we assist this person to increase their degree of confidence or encouragement to engage in activity? So a range of different things that are helpful. And these things are not just plastering over symptoms. These are actually optimizing the way the brain is actually functioning. So talking therapies can actually improve the connectivity of circuits in the brain to actually reduce pain. So they're very much a fundamental part of what occurs in a pain clinic. Besides the psychological therapies, we additionally have physical therapies. So we call that functional restoration or physical rehabilitation. And that's where you'll be involved with a physiotherapist or an exercise physiologist aiming to optimize your underlying physical condition. One of the things that happens in persistent pain is that people often change their activity levels, and a loss of activity levels can lead to what we call physical deconditioning. So you actually lose a degree of physical fitness, you might lose flexibility, you might lose muscle strength, you might actually lose muscle mass. So a number of these things then can add on to the pain, and so that the pain can expand over time. And if pain can expand, pain can also contract. So the way is actually to regain physical function is to be involved in a physical therapy component at the pain clinic. And then the fourth component are what we term interventional techniques. And interventional techniques are referring to particular procedures, often done via delivery with a needle of an injection, or a needle that actually is altering nerve function because it is pulsing a nerve or it's heating a very tiny nerve. So there are a range of interventions that can be applied to block pain at its source, or if pain cannot be blocked at the source, blocking the transmission of that pain up the chain of the nervous system to reduce the awareness of that pain up at the brain level. And the group at the pain clinic will say to you, we think this collection of treatments is optimal for you, or you only need 3 of them, or you only need 2 of them, as the case may be. So that's kind of what goes on in a pain clinic. And the concept there is that you're not wedded to this new clinic for the rest of your life that you have to attend once a month until you die. No, that's not the idea of what a pain clinic is about. Most pain clinics are going to say to themselves, we think we can optimize you as an individual, reduce your pain as much as possible, give you the skill set to manage anything that isn't going to go away over a 6-month time frame. And from that point on, you should have the skills and the confidence to be your own manager of any residual pain. And we have lots of patients that we're able to say goodbye to successfully at the end of 6 months, and occasionally we might see them in the years to come for some further brief interventions. So that's a little example of what goes on in a pain clinic, and I hope that's made things clearer and removed some of the myths.